Analyzing static posture, front view. Have your client stand 30 to 40 centimeters from the wall with their feet shoulder width apart. You have the choice to rotate the photo in either direction or to remove a photo that you don't like. To level the photo off now, take the green line and place it in between the junction of the floor and the wall. This will level the photo off if it's not quite straight. Clicking next, we come across to center the photo now. The vertical plumb line we place evenly between both feet, and the horizontal line we place on top of the head or the skull. Clicking next, we can now go ahead and annotate our postural image. We can change the color theme if the person's wearing dark clothes, or click rotation mode to make it easier to maneuver the lines. Starting with the earlobes now, we'll line up the bottom of both earlobes to see if the head is straight. Moving on to the acromial process, we line the line directly up with both AC joints to see if the shoulders are straight. Moving down to the 12th ribs now, we'll need to come in and touch our client here to ascertain if both ribs are at the same height, and we draw a line directly across. We do the same with the ASIS, the anterior superior iliac spine, to see if the hips are at the same height. Moving down then to the hands, we look at the number of joints we can see on the back of the hands. If we have perfect shoulder posture, all we see is thumbs here. We indicate, using the green boxes, the number of joints we can see. With the knee, we take a line directly down that passes through the center of the patella. If the feet are in the correct position here, the line should line up with the second and third toe, which is the center of the foot. The tibia and fibia there, we look for any bowing or straightening and indicate that in the green boxes. Both the left and right ankles now, we're looking to see, is the foot neutral? Does it pronate or does it supinate? We indicate this with the line and the arrows. If it's heavily pronated, we'll use 2 arrows, less rotation, 1 arrow. If it supinates again, we'll use 1 or 2 arrows to the outside. If the foot's neutral, we leave the box empty. We'll line up through the medial and lateral malleolus through the ankle bone to indicate this. Postural observations from the side view. Have your client turn to their left and place their feet at an even distance either side of the line. A quick look at the spine, which consists of 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and 5 sacral vertebrae. Leveling off your photo, we'll take the green line and move it up to the floor edge, or the junction where the floor meets the wall, and then click next. The plumb line will be lined up with the front third of the lateral malleolus or ankle bone, and should go through the knee, hip, shoulder, and ear hole if posture is perfect. The top line will sit on the top of the head or skull. Head and neck posture now, we line up the chin with the occipital bone, which is where the skull meets the spine. Neck posture then. We follow the curvature of the thoracic spine or upper back through the center of the ear. Here, ideally, we'd like to see an angle of 90 degrees if head and neck posture are perfect. Should the head be forward and the angle be less, we have a forward head carriage. If the ear hole is 20 millimeters forward of the plumb line, the weight of the head doubles. This can lead to neck tension and even tension headaches. Moving on to pelvic posture now, we'll be lining up the front and back of the pelvis, so from the PSIS at the back to the ASIS at the front of the pelvis. Here we're looking for anterior or posterior tilt, and that angle is automatically calculated for us. The cervical spine, we have the choice of adding icons for loss of curvature, excessive curvature, or normal curvature. Same with the thoracic spine, we look for normal thoracic kyphosis, hypokyphosis, or loss of thoracic kyphosis. The lumbar spine, here we might see loss of lumbar lordosis or a flat back. We might see normal lordosis or a hyperlordosis, a shallow one that extends to the thoracic spine, or a short, deep lordosis with an anterior pelvic tilt. Each of these less than perfect posture positions cause certain muscles to become inhibited and other muscles to become stressed, and increases injury potential. The forward hand can be seen from the front view, so if we notice that one hand jutted forward of the other, then we would indicate it here on the side view in the green box provided. This could indicate a shortening of the psoas muscle on the opposite side. The back view now. In the notes section for each image, we can add notes here that will appear in your client's personalized evaluation report. The heels are placed on the line 30 to 40 centimeters from the wall, and we now even up the photo as we did before with the floor edge, with the junction of where the floor meets the wall. The plumb line is placed vertically and evenly between both feet, and the horizontal line is placed directly on top of the head or skull. Clicking next, we can start to annotate the image. First, we look at the shoulder blades. We then want to line up the bottom inferior angle of the two scapula to see if the shoulder blades are at the same height or if there's any elevation of either scapula. Onto the ribs now, the 12th rib, we need to touch the client to feel this. We feel the bottom of the ribs, that we then line them up in our app to see if one rib is slightly higher than the other. Same on the back of the knees, we look to see if the lines on the back of the knees or the folds in the skin are at the same height or if there is any leg length discrepancy at the height of the knee. Onto the protrusion and the rotation of the scapula. We're looking here to see, is there any protrusion of the inferior angle of the scapula, or is there a unsticking completely of the scapula from the medial or internal border, known as scapular winging, and indicating weakness in serratus anterior, which is often associated with upper trapezius tightness and neck tension. The rotation of the scapula can be seen in the image on the right here with a downward rotation of the scapula. This indicates tightness in levator scapula, upper trapezius, and weakness in serratus anterior and lower trapezius. Onto the shape of the spine now. You simply choose the spinal shape that best matches your client's spine, clicking in the green box provided. If the spine is purely straight, then we just select straight. Onto the feet here, we're looking for any rear foot pronation or supination. So the aligning of the back of the heel. If we see excessive pronation, we'll use the arrows in. Excessive supination would be arrows out. Both of these are unsafe and increase injury risk potential. This whole postural observation process is a fantastic tool for finding your client's strengths and weaknesses and any predisposition to injury. So as a summary for the static postural observation photos, mark a line on the floor 30 to 40 centimeters from a plain wall. Always take the photos from the same position. From the front view, ask your clients to place their toes evenly on a line 30 to 40 centimeters from the wall. From the side view, the client always turns to their left and evenly places their feet either side of the line. From the back view, their heels are placed evenly onto the line and they face the wall.